Thank you. So nice to have you here.
Hi. Thank you. Thank you.
Great. So, Jessica, I know that you're working 100% dedicated to this project that we'll be talking about that is called Into Health.
Yes.
Yes, you do. Could you maybe give us an overview of what the project is about?
Yeah, sure. Into Health is a project that matches the healthcare needs with the solutions from the private sector and the healthcare. And we do this by starting off with well-defined needs from the healthcare sector. And as you can see, we are 8 organizations running this project together. And the project will work as a matchmaking platform to combine all the unique competencies from the industries involved. And the aim is to give the companies a good start to both develop and test and to introduce the new solutions, as well as an opportunity for the healthcare to find the new solutions. The project spans over a 3-year period with the ambition to involve 75 small and medium entities. So all in all, we do this to create new job opportunities as well as to enable companies to grow within this good life science region that we are.
Wow, that sounds like a good project. I know that you're all very much dedicated to the project, as all the 8 organizations are, but when it comes to Borås, Marie, what made the decision to join?
We believe that if you really want to make a difference, it's all about collaborations. And can we catch a qualitative range of actors, and we as science parks can support the project by building bridges over the different disciplines, I think that we can reach excellent results. And the different science parks have different knowledges and networking among the industries and sectors. And I believe for sure that this cross-fertilization will generate impact. So we strongly believe in this framework.
Cool. It sounds like a good reason. But tell me, like, Borås is to me about smart textiles and so on. And first of thought is like it's a big leap into life science. Is it so?
Not so big.
Not so big.
Within our park, we are working within the textile innovation area, which constitutes the majority of the projects that we run. And the aim is to create constellations between academy, public sector, and industry in order to realize solutions. And we work close together with the Swedish School of Textiles and the researchers there. And one of our focus area is actually the same as in this project. We're working within health and medicine. We're running projects together with Södra Älvsborgs Hospital, Södersjukhuset Hospital, and several clinics all around in Sweden. But also with companies where we develop textile innovative products. And we're focusing a lot in prototyping.
So it sounds like you have a good touch into life science, actually. Is there any tight connection that or learnings that you can bring to the projects up front?
Well, we are able to identify the SMEs in our network that could join this project. And we can also guide and coach the SMEs when it comes to textiles. And of course, contributing with experience we have from CrossCollaboration's projects. And it's easy to forget that textile is actually all around us, almost all the time. And it can be the solution, actually, a part of the solution in many cases.
Right, I think that you have a very interesting showroom in Borås. And if you haven't been there, go there, because a lot of the things that you were mentioning there is shown up front on concrete examples.
Exactly.
Hanna-Maria, could you tell me a little bit about why Science Park Skövde joined? Is it all about gamification, or?
No, we have a strong tradition to work together with the private sector and the academia. And we are integrating hardware with software between multiple disciplines, like the game, as you mentioned, but also industry, IT, technology, and fine tech. So, well, everyone knows what fine tech is?
No? Maybe can you spend a word on it?
So it's not fine technology, but it's financial technology.
Okay. So what I can hear here is that you have a good asset in understanding how you bridge different disciplines and get the best out of each example. Is that how it works, or?
Yeah.
Do you have an example of how
Yes,
that has
for
worked?
example, we have a physical arena that is called the Assar Industrial Innovation Arena, where research and the academia and the manufacturing industry and IT and technology meets.
Okay, that sounds partly very applicable to Into Health project. And do you also have an example for life science?
For life science, we have a project we've been involved, actually are involved in, that is the Game Hub Scandinavia.
Okay.
No, sorry, now we jump to life science.
Yeah, life science. Not
No,
gamer.
that's another project.
I know when we prepared
Yes,
this, you said
yes.
something about the serious gaming.
Exactly. We have it's another project that we have in serious gaming, where we have an arcade unit that is encouraging stroke patients to do a rehabilitation training.
Okay, that sounds really interesting and probably deep learning in that project as well. So, it sounds to me like one of the key success factors has been the collaboration and so on. Do you see how you can apply that to this project, Marie?
I can tell you.
Yep.
No, but development and changes is often impossible to do on your own. There could be solutions out there, but it's a need that several actors go together in order to achieve those excellent results that we want to reach, but also to generate general approaches of how to work together. And that is also important for future collaborations. And indeed, it's important if it shall affect an entire nation. And I believe it's relevant to widen the perspective. And if we can reach angles from different industries, sectors, researchers, and so on, I think that we can catch dynamics.
Truly, absolutely. Jessica and Marie, you both told me that it's important and that the starting point of this project is that you work with real defined needs. Could you tell me a little bit more about what we are today, where we are?
Yeah, so right now we are working with missed healthcare appointments, which is a huge problem within many healthcare functions today. For example, did you know that it costs 590 million Swedish crowns every year? And that's just within this region. So the ambition for Into Health is to facilitate solutions to reduce this amount and hopefully to do that drastically.
Wow. Did you say more than 500 million Swedish crowns just in this region? Okay. It feels a little bit blunt to ask, it's like that is one track. I know that you're planning for multiple tracks in this project to help out. Have you had time to start with the second?
Yeah, we do work with the second track as well, which is with orthopedics, who specializes in arthroscopy. And that the problems that they are facing is that they don't get the right amount of practice that they actually require. So what we want to do is to be able to increase the quantity of the practice and thereby increase the quality of these kind of surgeries.
Massive. So if you start with this real defined tangible need, does that mean that the outcome of the project only is applicable to this region only?
No, so one of the main goals for Into Health is actually to develop this process to be able to work in cross-collaboration projects. And during the 3-year period that we have, we will continually work to develop and iterate this process so that it could not only be applicable here in this region, but also nationally.
So it's one deliverable is to make a blueprint and a recipe that could be reused outside this region.
Absolutely.
Okay, sounds really good. So if this is the project and you described some flesh and bones for us, what does project success look like? Marie, if you would go out first and say, what is project success to you?
I would say that, and I would like that the result from the SMEs will surprise us and that we will clearly see the effect of these kinds of cross-collaboration projects. And of course, the willing, again, to meet up with the different science parks, SMEs, researchers in future projects.
Okay. Hanna-Maria, what is the taste of project success to you?
Yeah, and we hope to be in the heart of this network and have this cross-industry collaborations and, of course, making a difference in healthcare, both for employees and for patients.
Okay. Thank you. Jessica, and a final word from product success from you and your organization?
Success would be if you would walk into any hospital in Sweden and ask them, and they would say that we could never have done this without Into Health. That would be success.
Very good answers. And now it's just time to deliver and continue that good journey. You mentioned that you have started 2 tracks out of something like 5. So keep up that good work. Big hand of applause.
Thank you.
Thank you.